my question to you guys is, we're doing these, this state by state, it sounds like as of now. What's the trajectory, or is there a plan, or is there a possibility that it becomes a federally approved, is that the next goal? Would we rather just keep it in the state's hands so that it doesn't get, perverted by the...
Before you answer that question, I want to say one thing. It's so important to realize, like, we're talking about the fact that there's people that have opinions about this, that don't want this to go forward for whatever, fear, finance, whatever, some kind of block is in the way. I want to remind us, they gave a Nobel Peace Prize for the lobotomy.
Mm-hmm. Right.
Can you imagine?
Mm-hmm.
So that has destroyed so many people's existence and so many political family members' existence because they were trying to take care of someone's mental health. If we had this substance, there would have been no need for the lobotomy.
Right.
Yeah. So this is something that has the effort for, and the steam, the legs for a Nobel Peace Prize. Like this truly frees people from their mental torture. A lobotomy didn't free anyone from mental torture. And
just cut it out.
Yeah, I think that if there's going to be a pathway to answer that question for the federal government to get involved, I mean, we're going to have to remember things like that and then demand that we want to do better and that we have substances to do better. But right now, it looks like it's a lot easier to do this on a state-by-state level.
So when you think about your civics that you were taught in 8th grade, you have the federal government, which is the central organizing government force in America. But then you have the individual states, and there's a relationship there. And while we may have it in our mind that the states are mere subdivisions and agents of the federal government, that is not true.
No.
Under the 10th Amendment, they have the certain ability to do things on their own, free of federal constraint.
Right.
Just like convening a constitutional convention where you have 2/3 of the state legislatures get together, pass an amendment to the Constitution, completely bypasses Congress, and it's done. We are replicating what is sort of the equivalent of a constitutional convention. We are bringing in as many states individually to fund this medical breakthrough so that the federal system will be responsive to that concrete reality. It's not something for them to ignore. It's not something for them to negotiate and deny away. It is there for them to answer. And answer it they shall. And they will answer it with integrity, and they will answer it responsively, as long as we have good leadership on the inside, and we have some, that's willing to take a humanitarian perspective on the need to reform ossified and corrupted systems to make them be as they should, whether that is an individual like Secretary Robert F. Kennedy Jr., a man who 10 years ago I would never have dreamed that I would align on so many fundamental issues with. And while he and I might disagree over the color of the paint and the drapes that we'd hang in the house, we recognize the foundation's crumbling and we've got to make it right. And there are millions of people who recognize the same thing, who wear different labels, who have different skin suits, but if they ever got unplugged from their television and their social media algorithm and had a conversation about the day-to-day challenge of meeting that health insurance bill, of being able to access appropriate medical care, of what options are available to that relative that they love who can't manage to get out of addiction.
I also think it's so important, too, that we don't let ourselves as humans miss something or keep something from the people that we love because of someone's skin suit. You know, there's these, who cares what their other politics are? If they're going to help us push this through for the betterment of humanity, they're our guy, they're our gal, you know? And if you're so ignorant that you'll let someone's skin suit get in the way, then you're literally taking something, healing from your grandchildren.
Sure. Well, and like you said, you know, turn off the TV, put away your algorithm, and start having those conversations. And we're far more alike than we are different.